Hello, I'm Dr. Craig Werner, chiropractor practicing in Longview, Washington. I'm offering these free videos as a chance to maybe introduce you to a different way of looking at health and health care. At the end of this video, I'll put up my office phone number. Feel free to give me a call. If there's anything I can help you understand or help you with, I'm happy to do so. In the United States, we spend more on health care than any other country in the world. Doing so, you'd think we would be the healthiest country on the planet. We spent over $3.5 trillion, almost $10,000 per person in 2017. That's the latest data that I have available. We spend more than the next 29 industrialized countries combined for health care. So you'd think that we in the U.S. have the greatest healthcare system in the world. So do we? Well, according to the World Health Organization, the U.S. ranks as 37th in the world. 37th in the quality of health and quality health care. That means that there are some 17 third world countries that are rated ahead of the U.S. Places like Dominica, Cyprus, Morocco. So you have to ask yourself, are we really dealing with health care in the U.S.? Well, in 1973, President Nixon championed the Health Maintenance Organization Act. And what this act did is it turned to law healthcare becoming a for-profit business. Prior to this, it was regulated as a not-for-profit business in the U.S. So once it became a for-profit business, the corporate entities began developing within healthcare and the corporate mentality. So what that means is they're not really interested in your health. They're interested in the bottom line. They're interested in profit. Why prevent or cure an illness when it's a lot more profitable to treat it? Let's compare some costs of common procedures worldwide. Things like a hip replacement. There are hundreds and hundreds of hip replacements done in the U.S. every day. The average cost for a hip replacement in the U.S. is somewhere between $40,000 and $45,000. If you go to Germany, which has equal quality, actually probably better quality healthcare, and equally well-trained doctors, that same procedure, hip replacement, in Germany is $7,000. And much of that, the state pays for you. Look at something like pharmaceutical care. Hepatitis C. We've all seen the commercials for Harvoni, right? The one with the lighted lanterns floating out over the water. Well, a full course of treatment is between 8 and 12 weeks of a pill. You take a pill once or twice a day. In India, that 12-week course is about $1,200, or about $15 per administration. In the U.S., the exact same treatment is $95,000. Same drug, same length of time, same care. 90 times the cost. Big Pharma's mantra is, a patient cured is a customer lost. Because they're a corporate entity. We have some common attitudes about health. One of those is that having symptoms means I'm ill. Well, a symptom is merely the sign that the body is finding a way to respond to a challenge it's encountered. Something like, think about vomiting and nausea when you're fighting off food poisoning. It's the body casting off the things that are trying to attack it. The bugs that are in that food, which has caused the food poisoning. The body's found a way to respond in the proper manner. Childhood fevers. This is a fascinating subject. We have this tendency, as soon as we see a child with a 99, 100 degree fever, let's give them some Tylenol, let's give them some aspirin, liquid aspirin, baby aspirin, to bring down that fever. When in reality, the fever is the body's attempt to create an environment that is inhospitable to whatever it is that it's encountered. A child's immune system doesn't fully develop until about 8 years of age, and research shows that after the fever has run its course, the immune system is operating more effectively. The immune system has actually been bolstered. The pathogen that it's encountered has been programmed into the immune system. Should it ever encounter that pathogen again, it has an instant response because it knows how to manage it. More importantly, there are milestones of development, things that children normally will do. Let's say your toddler has been hesitant to walk on his own, hasn't seemed to have gotten a mastery of that coordination yet, and yet he's at an age when normally they do. Or your school-age child is struggling with some math concept that should be pretty easy to get, and yet something just hasn't clicked for them. We found that 48 hours after they have overcome a febrile event, something in the neurology got turned on, and that toddler will start walking on his own. He achieves that milestone. Or that school child goes, oh, that makes sense now. Something gets flipped over for them. And it's because of the fever, and we don't know exactly why. But the research has shown it time and time again. And I'm not talking about those dangerous fevers of 105, 106 degrees. Those you need to treat aggressively and bring down. But I'm talking about that mild fever of 100, 101 degrees that makes the child cranky and irritable. But there's not a danger. We don't necessarily need to treat that fever. Next is that no symptoms means I'm healthy. Well, if we learned anything from COVID-19, we've learned that this is a false concept. You can be very sick and yet still be transmitting disease and still be in the fulminating growth stage of disease and yet not show a single symptom. How many diseases have you heard called the silent killer? Right? Heart disease, diabetes, cancers. So many things that show no sign until it has become so big a problem that your body cannot overcome it, and then the symptoms show up. If no symptoms equals health, then why would we bother with mammograms, blood pressure checks, blood sugar tests, colonoscopies? The definition of health is never the absence of symptoms. A third thing is that germs cause disease. And yes, it's true. With many diseases there are germs present. Not so with things like cancers, autoimmune diseases, etc. But in many infections, germs are present. But we're all inhaling bugs, we're all encountering bugs, pathogens, day in, day out, all the time. Right now you're inhaling bugs. One pathogen in particular is called Pneumocystis carinii, which is a weak pathogen that we are all encountering day in, day out. And our immune system is so used to it, it just goes, oh, you again, and brushes it off and it's done. You don't even know it occurred. Your immune system did its job adequately. But in people who have compromised immune systems, who are maybe on chemotherapy drugs, who have HIV or severe autoimmune diseases, the Pneumocystis carinii pneumonia will actually overcome the patient, and they're unable to mount an adequate response to it. Masha and Dasha, this is a case that I found particularly fascinating. Masha and Dasha were a pair of conjoined twins, Siamese twins if you will. And they were born in the Soviet Union in 1950. Two girls attached at the pelvis. They shared several pelvic organs. They had, from the about waist up, they had discrete organ systems, each of their own. Their bloodstream was continuous between the two. They shared the same blood supply. And that's important because if you're infected with a pathogen, most of the time the bloodstream is the method of disseminating it throughout the entire body. So anything that one is exposed to, the other one is going to get. The one thing that they had that was entirely unique, entirely discrete between the two girls, is their nervous systems. Their nervous systems were completely separate. And this is important because on at least two occasions, the girls were exposed to some disease, one of which was measles and one of which was a flu. And in both cases, only one of the girls got sick. Now you have to ask yourself, they're sharing the same blood supply. Weren't they both exposed to the same level of disease? The answer is yes. But the difference is their immune systems were at different levels of competency because their nervous systems were different. One girl's nervous system was able to mount a more adequate response to that infection, where the other girls was not. And this was a light bulb moment for chiropractic, because we've always said that the nervous system is so involved in immune response and immune competency. And this just demonstrates it completely, because one girl got very sick and the other one didn't. And the only thing different between them was their nervous system's capacity to mediate the immune response. So the common causes of illness within humans are really the stresses that we are trying to manage. Physical stress, we all know that if you work yourself physically too hard, too consistently for too long, you're going to deplete your immune system's capacity and you're more likely to wind up getting sick. Chemical stresses are the things that we eat, drink, and breathe. Many of these are things that cannot be controlled. They're out of our control. And emotional stresses. We've all been under emotional loads, and you know that you can get sick much more easily when you're dealing with that. These are stresses that are reflected in the spine's ability to function properly as well, because the whole nervous system becomes excited and depressed at the same time. And the spine is unable to function properly, which puts even more stress on the nervous system. Another attitude we have is that drugs make us better. Well, last year we spent $535 billion on prescription drugs. It doesn't include the over-the-counter stuff, which probably matches that as well. So if we spend all this money on drugs and drugs are making us better, then why the heck aren't we healthier? Why are we 37th in the world? The chiropractic vision of health and health care is that we're measuring the body's functional capacity and functional efficiency through the spine's capacity to protect and facilitate communication from the brain to the body and from the body back to the brain. And that relates to the function of the spine at each spinal segment, each set of two vertebrae, because between every set of vertebrae there is a nerve root, which actually contains about 30,000 nerve fibers. A nerve root that exits and goes out to the periphery, carries information from the brain down the spinal cord out to the body, and information back from the body to the spine so that it knows how to respond and whether or not its response has been adequate. Chiropractic care actually improves immune function. And it does so by taking some of the stress off the nervous system. As the nerves exit the spine to go out to the periphery, they pass directly next to the spinal vertebrae facet joints. Those joints are just like knuckles. They're a synovial joint with a synovial capsule that encloses the joint. And if that joint becomes dysfunctional, if that joint is not moving properly, it becomes irritated. That capsule begins to swell. That swelling and inflammation affects the nerve root, which is directly next to it, and compromises its capacity to communicate with the body. They did a study some years ago, I think it was at UCLA, where they anesthetized a rabbit. They exposed his spine. They found a spinal root that they could stimulate that would cause his leg to kick. And they wondered how much stress would they have to put on that nerve before it would no longer be able to do that. And they found that the weight of a nickel was enough stress on that nerve to compromise its ability to communicate well with the periphery. And the same thing is true when the spine is dysfunctional. When those joints put stress on the nerve root, it compromises that nerve root's capacity to transmit information accurately from the brain to the body or back from the body to the brain. Chiropractic isn't just an adjustment. We're not a one-trick pony, so to speak. Chiropractic approach is a mindset of lifestyle, health maintenance, recovery, incorporating healthy choices, stretching, exercise, diet, and spinal care. We emphasize all these things and we are educated in all these things so that we can help you find ways to improve your overall approach to health. And nobody's choices are going to be perfect. I mean, you can't always control the water that you're drinking. If you're out at the mall, you're going to stop and get a drink at the drinking fountain. You don't know where those pipes, when those pipes were built, made, installed, cleaned, whatever. You don't know that even buying the organic vegetables in the store, you don't know all of the steps that it's taken to get them from the field to the store and what they may have encountered. But you can do your best to reduce those overall stresses by managing some of these things yourself. Thomas Edison said, "The doctor of the future will give no medicine. he, she, will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. I love it. William Osler, who was Johns Hopkins instructor of doctors, teacher of doctors, said the person who takes a medicine must recover twice, once from the disease and once from the medicine. And I love Oliver Wendell Holmes, also Harvard instructor. If all the medicine in the world were thrown into the sea, it would be bad for the fish and good for humanity. Each of us is instilled with this innate intelligence, this ability within ourselves to know how to manage healing. You take a 95-year-old person and you put a nick on their finger in 3-4 days, you do nothing to it, it's going to heal up. And it doesn't do that because they have 95 years of learning how to manage and heal themselves. No, because you can take a 90-second-old infant and put a nick on their finger, and 3 or 4 days, do nothing to it, it'll heal up. Because we are born with this innate capacity to heal and manage our own repair, so to speak. The power that made the body is the same power that heals the body. No doctor has ever healed anyone. The surgeon who goes in surgically and removes the tumor, he hasn't healed that patient. He's created an environment within that patient that allows the body now to heal itself. Same thing when I provide an adjustment to a patient. I haven't healed that patient. I've created an environment that allows the body to communicate well, brain to body, body to brain, taken some of that interference in that pathway off, and allows the body to do its healing. Thanks so much for your time. If I can be of any assistance, please feel free to give me a call, and have a great day.